clear that up for the record. I want to recognize now Mr. Courtney. You are recognized for 5 minutes, sir.
Thank you, Madam Chairwoman, and thank you for your courtesy to allow me to join the subcommittee today. And again, I just have a couple quick questions. Mr. Godfrey, recently I introduced legislation, bipartisan legislation with my good friend, Mr. Walberg, the Improving Access to Workers' Compensation for Injured Federal Workers Act, HR 6087, which will update the Federal Employee Compensation Act program to allow injured workers to seek care from nurse practitioners and physician assistants in addition to physicians. In 1974, when Congress amended the Federal Workers' Compensation Program, Congress specifically allowed workers to seek treatment from their personal physician in order to provide employees free choice of who provides their care. However, these changes only allow for a physician to provide their treatment and sign off on claims. In the interim, as I think we all know, physician assistants and nurse practitioners have become a major component of the healthcare system and supplement the physician workforce and serve as primary care providers and specialists across the country, especially in rural and underserved areas. Our legislation would align the federal law with the reality that nurse practitioners and physician assistants are the first line providers for many federal workers, and they should be incorporated into the program, and would help address barriers to accessing the compensation workers are eligible for, in part because it can be difficult sometimes to find a physician participating in the program. So Mr. Godfrey, can you describe the challenges that workers currently face in having their claims approved as it relates to finding a physician, and why is it difficult for them to find a physician willing to participate in the program? And lastly, from your perspective, would allowing physician assistants and nurse practitioners take some of these cases help improve access to compensation for eligible workers?
Thank you for that question. There's several things that I think are responsive to your question. First, I think the issues related to a federal system with physicians located in one state, sometimes they have difficulty with the billing practices. And what we're looking to do is move forward with a medical provider network, which would allow us to have a greater ability to access and work with physicians to make sure that it's easier for them to work with us, so that when they provide services, they can be timely paid for the services that they do provide. So I think that will be one instance. Obviously, you touched on the other issue, rural America. Oftentimes, I know coming from Iowa, it's difficult to have a doctor in a specific town. It may be that a nurse practitioner or a physician assistant is the only individual who can provide the immediate treatment that you need or the ongoing care that is required following a workplace injury. I would note that my prior position was as the chief judge of the Employees Compensation Appeals Board, and it is accepted within the FECA program for nurse practitioners and physician assistants to provide care. I think the distinction that we have seen is that based upon existing case law or regulation, that a physician is given greater weight in terms of an opinion than a physician assistant or a nurse practitioner. So I think that is where we need to be careful in terms of moving forward. But I agree with you, the more that we can do through telehealth, the more we can do to utilize nurse practitioners and physician assistants will make it much easier for the claimant population to get the care that they need.
Great, well, thank you. And as I said, this is a bill which in my opinion is just sort of updating the law and modernizing the law. And it basically allows the law to be aligned with the reality that's out there. And I think all of us can personally attest to the fact that, the role that this, level of practice is now well established in the US. And we just want to make sure, again, that the federal employee compensation system reflects that with this update. So thank you for your testimony, and thank you, Madam Chairwoman, for letting me participate this afternoon.
And thank you, Representative Courtney. I'm going to recognize Representative Stevens, and then we'll get to Mr. Mervyn. Representative Stevens?
Yeah, I'm here, Madam Chair, and thank you so much for having today's important hearing. This is one of the major reasons I have been just compelled to serve on this committee and do the work of this subcommittee.